Hey everyone, welcome back to the course. So in the last video, we talked about the security rule. We took kind of a deeper dive into it so you can fully understand it. Again, the main differentiating factor between the security rule and the privacy rule is that the security rule covers electronic protected health information, or EPHI. In this video, we're going to talk about some of the common issues that HHS has seen. So some of the most common issues. We'll also talk about the entities that are basically being required to take corrective action. So the most popular culprits when it comes to violations. And then we're also going to talk about the violation penalties themselves, so both the civil and criminal aspects. So the most common issues that are protected health information. So, and most people could probably have guessed that one, that, inadvertent use of it, or or disclosure of it, or that somebody's actually abusing it, so somebody like stealing your social security number and opening accounts or something like that. The next one up is no protection in place for your health information. So organizations not actually following HIPAA, not putting standards in place, not putting policies or procedures in place, not following things like technical safeguards for the information. That's kind of the patients not being able to access their health information. So again, we talked about that within 30 days, the provider has to give you that information. That's why I mentioned, again, it's not legal advice, but that's why I mentioned that you should put stuff in writing. And that way you've got a history. So that way if you need to escalate things to, some entity or like legal counsel, you've got the proof that you actually requested your records. Next up is minimum necessary, right? So using or disclosing more than the minimum necessary protected health information. So again, going back to, somebody like looking at, Beyonce's medical record chart just because it's like, oh, it's Beyonce, let me see what she's got going on. That would be a violation of HIPAA, and that would actually probably get you, just because it's Beyonce, you'd probably get some criminal charges too on that. And then no safeguards for your electronic PHI, so not using encryption, right? Not password protecting stuff, just, texting patient information via text that's not encrypted, all that fun stuff there. And then the most common entities, most of us could have guessed hospitals, but some people might actually be surprised that private practices are number one on the list. And then we also have outpatient facilities, so like your surgery centers, that sort of stuff, group insurance plans, and then pharmacies. And in my opinion, I actually thought pharmacies would be higher on the list. I figured they would be around number 3 or so. But you see they're number 5 on the list for HHS. All right, so now let's talk about HIPAA violations. So we're going to talk about some specific numbers here, and these are based off HIPAA. This could always change depending on when you're watching this course. There can always be new legislation, so just keep that in mind. But I wanted to give you just some general context of different civil or criminal penalties under HIPAA. So just so you can really understand kind of the seriousness of any violations, this is a serious matter. Even though I may be joking in this course, it definitely is a serious matter, and we want to definitely protect the information. So some civil violations of HIPAA. So if you, basically if you're an individual and you unknowingly, so it's, I've got listed there accidentally. So if you unknowingly violate HIPAA, generally speaking, it's going to be about a $100 fine per violation. So if you've done that with like 100 patient records, or 1 million patient records, you can do the math, right? You can get hit with a lot of money. But there's a max on that. Generally speaking, the annual max on that is $25,000 for those that repeat the violation. So if you did it, with a bunch of patients, you're going to probably pay max $25,000 out of pocket if it can be proved that there was actual intent. It's kind of odd that you would unknowingly violate it at that level, but it's possible. You can also get a hit with $50,000 per violation as well under that, or even an annual max of 1.5 million. So there's some very steep penalties civilly that you can get hit with just for unknowingly violating it, right? For a violation that's due to reasonable cause but not due to willful neglect, there's a $1,000 charge per violation, or an annual max of $100,000 for those that repeatedly violate, so for a $50,000 penalty per violation, or an annual max of 1.5 million. I don't know about you, but I don't really want to spend 1.5 million on a HIPAA violation, so I certainly would try to follow HIPAA to the best of my ability. Now, if you violate it due to willful neglect, with the violation being corrected within a specific time period that's set by HHS, then there's, generally speaking, a $10,000 penalty per violation and an annual max of $250,000 or $250,000 for people that don't know what that is for repeat violations. Make it sound like you're winning the lottery or something. The opportunity to get a $50,000 penalty or annual max of $1.5 million. Again, none of this should be construed as legal advice from me. I'm not an attorney, and even if I was an attorney right now, I certainly would not be giving you legal advice in a HIPAA course. And then the other civil penalty is for violations that are due to willful neglect and not corrected. And so the penalty there, $50,000 per violation, annual max of $1 million, plus $50,000 per violation, and annual max of $1.5 million. So again, some very steep civil penalties there. Now, that being said, these are individual ones. If you're a company and you've got breaches and you're not doing the right thing, you can get hit with a lot of money. And actually, HHS has been going after some companies over the past couple of years and hitting them with some pretty steep fines. So just keep that in mind, that if you think you're, off the board with some really cheap, options on violations, that's not the case if you're actually an entity. These are just for individuals. Now for criminal, who wants to go to jail, right? Well, some people do, but anyone in their right mind probably does not want to go to jail. It's not fun being locked in a little cell and having to deal with people that you don't want to deal with, on the normal day-to-day basis, and then you've got to sit there in a cell with them. That's not a fun thing, probably. I've never been to jail, and I have no plans to ever do that. Way too old to be causing chaos in my life nowadays. So let's just talk about HIPAA criminal violations here. So for entities that are covered and also specified individuals who basically obtain or disclose the protected health information willfully and knowingly, the penalty can be up to $50,000 and imprisonment up to 1 year. For offenses that are committed under false pretenses, the penalty can be up to $100,000 and imprisonment up to 5 years. And then for offenses committed with basically malintent, right? So the intent to sell, transfer, or use the information for commercial advantage, personal gain, or, as I mentioned, malicious harm, penalties up to $250,000 or $250,000 with imprisonment up to 10 years. So you can get hit with quite a bit of criminal time for HIPAA violations. It just kind of depends on what they want to do to you at that time and kind of the level of the violation you do. So some different examples of HIPAA violations, just so you can kind of get some context. Again, we're going to be talking about some scenarios in the module 2, but just understanding what it could potentially look like. These are ones that are actually from HHS directly. So the top one there, what happened is the hospital staff actually disclosed HIV testing results concerning a patient that was in the waiting room. And so their punishment there, they had to take regular HIPAA trainings, and computer monitors were also repositioned. So basically anybody walking by could have seen that, Joe Schmo is positive for HIV, right? Next one is actually an office manager at a practice accidentally faxed confidential information to the wrong number. And so they got a stern warning letter. I always love when I see they made them do a stern warning letter. Anyways, that's just me. And they also had a mandate for regular HIPAA training for all the employees in the practice. A surgeon was actually fired for accessing celebrities without an actual need to know. And they also got fined $2,000 and they got 4 months in jail. So just keep that in mind, that if you want to go look up Beyonce's records and you don't actually have a need to know, you're probably looking at some jail time. Also, private practice lost unencrypted flash drive, so they got a big fine of $150,000, and they also had to install corrective action plan. You'll actually see this more commonly with people losing a laptop. You'll actually see it a lot, like in home health. You'll see that a nurse leaves their laptop in the car. They go grab a bite to eat, and somebody breaks in and takes her laptop. And then of course the laptop's not encrypted or something like that, and they steal it, or it may actually be encrypted, and you still have to report that, or you may still have to report that depending on the nature of the theft. And some other ones here where people, did fraudulent paperwork, essentially. Also, somebody posting on social media about a patient. Of course, don't do that, right? And actually, I think the social media one, if I recall, was related to a nurse posting about a patient, like shouldn't have been drinking and driving, like posting photos of a patient. So don't do that, by the way. Number one, it's not cool anyways, and that's my opinion on it, but it's not cool anyways. But number two, you could potentially be looking at jail time for stuff like that. Like, what's the point in that? Also, what happened with a doctor's office with a public calendar. They actually were posting like patient appointments on a public facing calendar. So they got fined $200,000 for doing so, because obviously you can't put patient information out there like that. And then there was a data exposure for an organization for basically 5 million people were affected. I don't know the actual fine or anything like that on that, but that was a large data exposure. And if you've again looked in the media over the past couple of years, you'll see that there's been many organizations hit with large fines for exposing patient data. So some drawbacks that people talk about with related to HIPAA, hey, it affects clinical care. We've got to do all these extra steps, and now it takes longer to treat patients. The reality is, at least in my opinion, with electronic stuff now, it's a little faster to treat patients. There's still a lot of documentation. So if your organization uses like an older EMR, EHR system, or basically electronic medical record or electronic health record system, if they're using like older software, sure, it does take, it can be cumbersome. But much of the newer stuff nowadays, the more recent software out there kind of streamlines things for you. But it does cost more money. So if your company's cheap, then you may be stuck with the older stuff that does take more time for patient care. Another thing that the argument is that related to education or training, like, hey, we got this extra training we have to set up now and figure out how to do it, et cetera, et cetera. The other main thing was research. So what the argument is that it actually has less people applying to do research things, or less patients applying, because now they've got to go through and fill all this cumbersome paperwork out and do all these extra steps. So we don't want to do the research now. And then, of course, the cost associated with implementing like training programs and that sort of stuff. So just a quick post-assessment question here. What's the main purpose of the security standards for the protection of electronic protected health information? All right, so the answer is B as in boy, establish standards for protecting EPHI only. So if you didn't actually pay attention to the slide as I was going through it on the security rule, that's actually the official name for the security rule. It's the security standards for the protection of electronic protected health information. All right, so in this video, we just wrapped up our discussion on different penalties related to HIPAA. So we talked about civil and criminal penalties. In the next video, we're going to jump into our cyber attacks. So we're going to have some fun with that.